My name is Gabriela and I'm a senior within the Global Health Honors Thesis program. My research is regarding restructuring interventions for healthcare providers and patients in order to prevent Black women from dying from heart attacks in the United States. So Black women die at higher rates from heart attacks than any other subpopulation within the United States, despite interventions and campaigns targeted specifically for the subpopulation for decades, indicating that there are implementation gaps that haven't yet been addressed. Within my research, I identify these barriers and create a matrix for both patients and healthcare providers in order to help reduce these health equity gaps and lower the rates of preventable death. This is largely an intersectional and multifaceted issue in which gender and race stereotypes and atypical symptom presentation are at the core, presenting barriers within immediate treatment, timely care, and diagnosis, as these issues, along with communication, feed back to each other in a vicious cycle. Therefore, these issues have to be kept at the forefront when creating interventions for patients or for providers. For patients, in addition to addressing stereotypes and atypical symptom presentation, when to seek care and benefits of using emergency medical services needs to be addressed. Using motivational guidance, personal risk factors such as underlying health conditions need to be discussed before moving on to modifiable risk factors, such as diet or exercise habits in order to create change. For providers, gender and race stereotypes intersect with atypical symptom presentation, leading to issues with timely care. Therefore, guideline adherence must be emphasized. For example, if a Black woman presents to the emergency department with gastrointestinal symptoms, an EKG should be conducted within the first 10 minutes of arrival. And that would decrease rates of misdiagnosis. It can then be emphasized that subpopulation-specific treatment is necessary because in addition to differences in symptom presentation, there are differences within risk factors to immediate treatment, such as increased risk for bleeding. For providers, it's necessary to conduct these interventions within a standardized and centralized database in which they can collaborate with other providers and have training and cultural humility. This database can also provide specific recommendations for the subpopulation and downloadable patient education files. The significance of my research indicates that health equity is achievable. We can prevent Black women from dying prematurely using this matrix, and we can further address other health equity issues using this approach, in which you get down to the root causes and start mapping out from there where the intersections lie and how we can address each of these factors individually and together. Thank you.